become mental health disorder. I'm Queen Esther. So it is important for us to understand mental health disorders and so that it can aid our promotion and reducing stigma and providing necessary support for people with mental health conditions. So mental health conditions are also known as psychiatric disorders or mental illness. So it is a condition that affects a person's thoughts, feelings, and behavior, which actually impacts on a person's daily function, relationship, life, and overall well-being. And there are so many types of mental health condition. There is mood disorder, there is anxiety disorder, there is substance use disorder. So today, okay, let me start with mood disorder. Mood disorder is a consistent, persistent feeling of hopelessness, helplessness, loss of interest in activities that are previously enjoyed, and they are in different forms, right? There is depression, those are depressive disorder. It can be major, right? And there is bipolar. So bipolar, is like being at the two extreme pole of emotion. This moment, this person is high, very energetic, doing things, and in most moments they are, in a depressive mode where there is no willingness, no energy to do things. And bipolar it can be there's type 1 and there's type 2 bipolar, which can be manic or hypomanic episodes. And so I just want to briefly mention them. And so another mental condition I'll be talking about is psychotic disorder. So psychotic disorder are, popularly called break in reality. So, and the symptoms are always centered around thinking, perceiving, and they have some common features, right? Before you can say that someone has a psychotic disorder, there should be presence of hallucination. That is, the person is hearing or seeing things that other people could not see. And sometimes there is delusions, and delusions is holding on to false belief. Someone saying that I'm a king, I also saw amounts of money in the bank when it was not so, right? Someone saying that, oh, I've lived one life before, break in reality, I have money with World Bank and all of that. And there's always disorganized speech, and that's why you see that, oh, the person is talking off points, and sometimes there can be disorganized or abnormal motor movements. That is the way the person is moving his or her body. Sometimes some people can be static, they're just looking. Emotions are not properly expressed, right? And so these are key indicators to psychotic disorder. Yes, in management and in assessment, there are other things that that your mental health professional will look at, but these are like 4 key ones that is very common with psychotic disorders. And there's anxiety disorder. And normally there's a level of anxiety that is necessary for every human being. We need some level of anxiety to be able to deal with problems, look for solution and all of that. But it becomes a problem when it's persistent, when it begins to affect the functioning of the individual. So it can be panic disorder. There is social anxiety disorder. There is generalized anxiety disorder. That is, the person is just anxious about a lot of things, not really anything specific. But in social anxiety disorder, you can have like the individual is always avoiding other people, where people are, like even eating in front of other people, going out, and is affecting. One thing we should know about disorder is it's affecting the functioning of the person and people around them. There is panic disorder. This is a persistent and reoccurring panic attacks that can, sometimes start suddenly, quickly, someone feeling a sense of danger around them. Okay. And the last one I'll talk about today is trauma and stress related disorder. And I'm sure many of us who are familiar with the word PTSD, post-traumatic disorder. This condition is always developed after experiencing a traumatic event. It can be directly experiencing that event, and sometimes it can be witnessing the person involved, right? So PTSD is when an event is being experienced, or sometimes it manifests by remembering or being triggered by sound or the smell of that thing that caused the traumatic event. Sometimes dreaming about it, having intense feeling of distress. Sometimes it can be physiological, that is, it can be physical, like excessive shaking, tremor, and all of that. And sometimes it can be psychological. So it is important that we know that this can happen to anybody. Like I said in the other video, that mental health condition is not because the person is lazy or the person does something really, really bad. It can happen to anybody, and it can happen at any age. So the reason why I'm doing this video is to sensitize us and to encourage us to support people with this condition and point them to the right help. So some other time we'll be talking about treatment option for managing mental health condition. Thank you so much. My name is Queen Esther, and I'm a mental health counselor, addiction prevention and treatment professional. See you another time.